Cold and flu season is back, and this year health experts are warning that it could hit harder than usual. They're urging Canadians to take precautions early. Health officials say early data from countries like Australia, where flu season starts earlier, shows higher infection rates and more severe cases than recent years. That's often a sign of what's to come for Canada.
Are we going to have a tough flu season? Probably. We probably are. Australia had 2 tough ones in a row, including the most recent one. We're probably in for a tough one. We're looking at some other countries in the Northern Hemisphere who are seeing a lot of H3N2.
This year's flu shot is designed to protect against strains like H1N1 and H3N2. Both are subtypes of influenza A.
In a typical influenza season, one of those is more dominant. And it's not quite clear if H3N2 will be more dominant than H1N1. But if it is, usually H3N2 seasons are more severe than H1N1 seasons.
However, at this point, experts say it's hard to know how well the vaccine will match against the current strains.
The reality is we try to predict what the circulating strains will be and try to mimic that in the vaccines as they come out, but that will always be subject to change. The important thing is that regardless of how well the vaccine does match, getting the vaccine will help anyway, because there will always be some degree of match.
Health officials say now is the best time to get vaccinated to protect both individuals and the healthcare system from being overloaded.
It takes time for the actual immunity to ramp up after you've taken the vaccine, and we would usually see high flu cases occurring around Christmas time, right after Christmas time. That's usually when it hits the hardest. And as a consequence, the hospitalizations tend to boost or peak in February.
Those most at risk include young children, seniors, pregnant women, and those immune compromised.
I think the most important thing to remember about respiratory virus season is that we have multiple respiratory viruses, several of which are preventable with vaccines. So RSV, COVID, and influenza are all respiratory viruses that you can get vaccines for.
Anyone 6 months or older is eligible for the vaccine. Health experts are also reminding Canadians of simple precautions, such as washing your hands, staying home when sick, and wearing a mask in crowded spaces. In Toronto, Catalina Gillies, City News.